Namaste. Welcome to Vivekananda Yoga University, the first yoga university outside India doing graduate education research. This is our Distinguished Speaker Series webinar. We are so honored to have Dr. Nagarathna Didi here. So with that, let me introduce our esteemed speaker today, Dr. Nagarathna Didi. Again, I'll not do justice to her full bio, but Dr. R. Nagarathna, affectionately known as Didi, is the medical director of Arogya Dhama, which is the integrative medicine hospital, holistic healthcare center at Prashanti Kutiram in Bangalore. Having mastered yoga, she combines the best of East and West, the ancient traditional yoga with the modern medicine for treating non-communicable diseases, NCDs, such as asthma, heart disease, cancer. And apart from being, of course, medical director, as an academician, she is an esteemed Vayu faculty and has been guiding many PhD students. Again, there's much more to say about her, but we'll, of course, listen to her live. Today's session is about holistic yoga therapy for NCDs, non-communicable diseases, which are long-lasting conditions that are not transmitted from person to person, but typically caused by a combination of genetic, physiological, environmental, and behavioral factors called mind-body diseases that are strongly related to lifestyle. Yoga offers a conceptual basis of healing as well as the techniques and the practice. And Dr. Nagarathna Didi and her team have developed the holistic and integrated approach to yoga therapy that has been validated by scientific research. The process of holistic healing is called Pratiprasava, that is to return complete reversal of the disease process that is due to involuntary locked up excess bioenergy or prana in specific organs. So in today's session, she'll be presenting the conceptual basis as well as the scientific evidence. So with that, I hand over the floor to Dr. Nagarathna Didi. Welcome, Didi. Thank you for your time. Namaste.
Namaste. Namaste. Let us begin with the Om. Take a deep breath. Make yourself comfortable. Start. Om has 4 components. Roughly gauge the length of your exhalation. Let 25% be for the first part. Second 25% of your time for O. Third for M. And when you say, don't say it, Om. It should be Om only. And 4th portion is silence. Let us begin. Tune ourselves to the expansion, infinite silence, and infinite bliss. Om. Let me share my slides. I bring greetings from Vivekananda Yoga University, based in California. I am a allopathy doctor, if you like, also with a master's degree in India and in United Kingdom. What is the health application of yoga? The health application is, we as normal human beings, we have our own limitations in our balanced functioning of our health, and when it becomes more severe imbalance, we become animal level, instinctual level. But as we become better and better masters of our monkey mind, we grow to be great human beings, moving towards greatest freedom, the source of all creativity, source of all knowledge, source of all freedom. And that is the state of a yogi, where we tune up to reality. All of us have seen this WHO definition of health, which is defined as a state of well-being at the physical, mental, social, and spiritual level, and not mere absence of illness or infirmity. We call all these NCDs as lifestyle. In 1970s, I was working in a rheumatology department in United Kingdom, and by that time we already knew that is rheumatoid arthritis is autoimmune disease and has got a psychosomatic component where mind is very important. Over the years, there is a lot of research on NCDs to understand the mechanism of how mind connects with the body to create this imbalance and a disease. Only name has changed over the years. What we used to call as psychosomatic became mind-body medicine, and today we use the word lifestyle diseases. But nothing much has happened as far as reversal or understanding the mechanism of cure. I must share this. We were conducting asthma camps for hundreds of people, and we could see that there are good number of patients with asthma who had completely stopped their medication, are completely healthy and happy with normal lung functions. And we were discussing with the modern medical asthma specialist. I'll give you 10 patients who are completely free from medication and their lung function also come back to normal 10 years. Can you call them cure? They would say, no, 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 no. You can't call it as cure. You can only use the word remission, because if provoked by bronchospasm inducing inhalation, then also if they don't react, then only we can call it cure. So this reversal or Pratiprasava, as Prashant mentioned, is possible when we learn the root cause of the problem. What we tell our participants is that this is a lifestyle problem where we look at 4 aspects: diet, lack of physical activity, bad habits, sleeping, bad habit. Today, what is the biggest bad habit? Screen addiction. Children were, before the pandemic, used to sleep at 1 a.m. and wake up at 9 a.m. Now they sleep at 4 a.m. and get up at 12 midday. This addiction to the screen has become one of the major bad habits, apart from other drugs and alcohol and sleep deprivation, stress. So all these, if we go on talking about it, we have understood a lot of that. But we should mention that in spite of all these incidents and prevalence of NCDs are on the increase. Why? Because of our mind. So here is a science which talks about mind, and mind is the root cause, and diseases are sitting on the branches. So what exactly is happening in the mind is what we should understand to tackle the disease at its root cause. We know that they are called as stress factors, which we call as negative emotions. We all live for our emotions. We all love to be in positive emotion, but the negative emotions can go on and creates all these problems. The sage has called all our long list of negative emotions, which we don't want but swallows us as kama, krodha, lobha, moha, mada, matsarya, the 6 enemies of mankind. Let us understand, therefore, what is happening in our mind, which can cause such huge problems, creative diabetes, right up to cancer, or psychiatric problems. What do we define stress as? Stress is defined as a physiological, starting with psychological to physiological response to demanding situations of life. And there is a physically challenge. Say you are seated and we hear a fire alarm. Then there is a already set, involuntarily programmed response pattern. The entire system, it helps me to fight or fly away from the situation, which is protective. But what is happening in today's lifestyle, the same responses which was necessary as a protective mechanism, where everything gets stimulated, then comes back to normalcy, has become today has become a long-term persistent response for psychologically challenging situations with stimulation of all our activities, and that is causing a long-term chronic imbalance. So that imbalance is the root cause of the problem at the psychoneuroimmunological level. We take two major concepts from traditional texts like Yoga Vasishta, Bhagavad Gita, etc. One is the pancha kosha viveka, the five aspects of our personality, the physical body, which refers to the anatomical, chemical structure, which is stagnant, which is non-functional without the prana. So prana allows the physiology to happen. So that aspect of our personality is called Pranamaya kosha. Then what is the definition of stress? Let us quickly run through this. So we have very major aspects of our personality. Who am I? I'm not only the physical, chemical body with atoms, protons, neutrons, but it is much deeper than that. That is a prana, which enlivens, carries on all functions of the body. So that has a particular physiology, it has got its own anatomy through which prana flows to each and every organ. Then we have our mind, Manomaya kosha, which has two major functions, perceiving, responding. We perceive that there is such a danger and immediately reacted at the physical level. But mind level reaction is preliminary. If I had not perceived that fire alarm is dangerous, I wouldn't have been able to respond and protect the body. So perception, lower mind, perceive and immediate reaction. This is the lower mind or the Manomaya kosha, which is essential, which is where we see all the emotions, negative emotions, positive emotions, all immediate responses. Subtler than that is our Vijnanamaya kosha, or the inner mind, deeper mind, or the subtler thinking, which guides the Manomaya kosha. For example, the boss is shouting at you and you are very angry, and Manomaya kosha would say, come on, give it back, shout back at him. And what will the Annamaya kosha tell us? Sorry, sorry, keep quiet, no response, no response. Just don't even lose your smile on your face. Receive it without reacting. So Manomaya kosha is telling, react. Vijnanamaya kosha is saying, no, 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 stop it. That is the discriminating capacity that is inbuilt only in human beings. There is one beautiful saying, ahara, nidra, bhaya, maithunancha, samanyametato, pashubhe naranam, buddhi, tesham adhiko vishesha. What does that mean? Ahara, hunger, nidra, sleep, bhaya, fear of extinction, maithuna, procreative instinct. These are common to animals and man. Everything is already programmed well said and goes on in a very structured manner without any interference. But what is something higher than that in mankind, that is buddhi tesham adhiko vishesha, a discriminating capacity, perception after perceiving whether I should react or not, is the intellectual input that helps us. So we have, when we are in the animal kingdom, there is no choice, only one response. But we have three possible responses. I can react, or I can stop reacting, or convert my anger into Maitri Karuna and become a friend to the same person who shouted at you. So this choice is the inbuilt extra mechanism which we are always using continuously. But when the Manomaya kosha becomes totally violent, we lose that capacity to master that and end up with problems. Subtlest of all this is a beautiful, blissful, quiet, enjoyable state which we all experience in our sleep. It is a rejuvenator, it is a health maintainer, and we understand this in patients. One of the major things that the patients tell us is whichever is the NCD, whether they all have sleep deprivation, sleep problems. So pushing them into sleep, Anandamaya kosha, where it is the source for healing, is the health understanding of this. So, as I told you, physical body, prana body carries on all physiological functions, Annamaya kosha, perception and emotions, and what is the yogic understanding of NCDs? We call them stress-borne diseases, and this is the common problem which is going on, increasing, and all our psychosomatic problems are beginning in this stress. So when we want to manage the stress, how does yoga define stress? For this, sage Vasishtha is asking you a question. Please tell me from your own experience. You stand at the background and you are angry now. Angry with somebody. Horrible fellow, useless fellow, terrible fellow. How can you call me by such bad names? These are the four thoughts that are running in your mind. And many a times we suppress that also. The introspective definition, if you look at your own mind, the example of the fire fighting, when you heard the fire alarm, you became anxious first. And what was happening? Oh, there's a big fire, let me go and put it out, let me run away from this place. What happened? If it was controlled speed, we would be very functional. What happens in some of us? My God, fire, 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 fire. What's going to happen? What's going to happen? What's going to happen? We pick up so much enormous speed, which I call as anxiety. So in all our negative emotions, distressful situations, what is happening? There is uncontrolled spinning speed of thoughts, which is the starting point. When it is short-term, reversal is possible. But when it is long-term, persistent, unrepairable, involuntary reaction, it becomes a problem. So what would happen? We are only using our brain for this to go on rewinding in our mind level, and the brain gets exhausted, starts getting deprived of its neurotransmitters, and start releasing wrong stress-related chemicals which go and work on the nervous system, endocrine system, immune system. Three communicators between the brain and the body. The nervous system, autonomic nervous system, the sympathetic. Then we have the endocrine system, the hypothalamus and the pituitary, and adrenal gland, steroids, and also immune system. These are three fellows who are the captains who connect between the mind and the body. And once excited, stimulated, if they are short-term responses, it is helpful, but long-term sympathetic excessive activity starts showing up as high blood pressure, etc. So this imbalance created by over durations, excessive duration of stress responses could be useful responses also. In today's lifestyle, we have large amount of challenging situations at work, and we all have to work. We live very near the software companies in Bangalore. Bangalore is called as the digital hub of India, and we are very close to this electronic city. When we talk to them, we wonder how the system can adapt to working 14 hours a day, 16 hours a day, without rest even over the weekend, which is helping us to grow, helping us to produce, helping us to grow economically, intellectually, etc. And that is a wonderful gift that human system has to prolong, get mastery over our sleep, etc., and go on using our brain. But along with that, the useless responses, the emotions, anxiety, stress, fear, excitement, are the ones which create more reactivity and persistent long-standing responses at the mind level has to be tackled by using our analytical faculty, the Vijnanamaya kosha, and help our people to come out of this USST, uncontrolled spinning speed of thoughts. And that is what is the response pattern that we have to work on. And what does medical science know about this? We have said for years, 40, 50 years, that mind is the root cause. But what have we done about the mind? Where do we go? We go to a psychologist. Psychology is only 100-year-old science from, we call Freud as the father of psychology. But even today, we are still trying to define what is mind, what is behind the mind. The modern psychology does not even know what is. Is there anything in our system that is beyond the mind? But here is a science from our Upanishads, 5,000 years research, where they were able to clearly define mind, understand mind, handle mind, cool down the mind, or increase the capacity of the mind, for the greatest research. So what happened then? Control speed at the mind level needs a lot more bioenergy. So we push a lot more prana to the head region, which shows up as breathing apart, hardness, etc. Prane adhurite yate, says Yoga Vasishta. The prana becomes so turbulent, and that is what is creating the problem. And after some time, it settles down in the physical body as a problem. Now, taking the example of diabetes, the speed at the mind level, speed at the prana level, suppressed, pushed down to the physical body. Why should it get attached to only pancreas or heart or joints or any particular tissue of the body. This is because of the hereditary tendency. Tendency does not mean it is a genetic disease. We have inherited a gene which is dormant, and when we release the wrong chemicals, create a negative environment around the gene that is pushing the uncontrolled spinning speed of prana to that particular organ, which is hereditarily vulnerable. That gene starts expressing, creates diabetes, or creates hypertension, creates schizophrenia or cancer. So genetic tendency decides which organ is going to be the sufferer. Therefore, the sages define these diseases as Adhija Vyadhi, Adhija and Anadhija Vyadhi. Adhijanya Vyadhi. Adi is an internal imbalance, and diseases born out of this internal stress-related, mind-related imbalance, they defined as the lifestyle diseases we are talking about. Yoga has a role even in non-communicable diseases also, which I have just seen during the COVID pandemic. A big harmful germ entered our body, but when people maintain this ability to handle their system by yoga, then they were able to come out of the damage. So, what is the remedy? The remedy should be everything is an imbalance. So, we have to bring it back to samatva, balance. So, reduce the sympathetic overactivity, reduce the immune overreactivity, reduce the endocrine overreactivity, and bring it down to balance. Sympathetic reduced, parasympathetic activated is the purpose. How do we do that? Now everything is uncontrolled speed, settle down in an organ or a joint as uncontrolled inflammation, fighting. Therefore, we have to design techniques at the physical level, wherever the inflammation is happening. We have to see that we design specific physical yoga techniques to release, give rest to this organ. So fighting going on in my joint, I have to move it gently and then relax. So giving deep conscious, wakeful rest to the sick organ by bringing the mindfulness to that area is the physical yoga, which is a part of the integrated approach of yoga therapy we use in non-communicable diseases. So at the physical level, we have the healthy sattvic diet, cleansing techniques, and physical yoga. Then at the prana level, we have pranayama, mind level, meditation techniques. And at the knowledge level, a notional correction. What am I rushing and speeding? What is the purpose of my life? How do I control my monkey mind, which is the root cause of my problem? And using the discriminative capacity, we push ourselves to come to that state of blissful, calm, background state and go on working. Krishna in Bhagavad Gita says, learn the art of maintaining a background, quiet, relaxed, silent state, which is your true nature, and go on working using your physical body, breathing body, or mind body. Doesn't matter. Yoga stha kuru karmani. Go on working, but maintain that inner peaceful silence. So, yoga clearly talks about healthy, simple, vegetarian, wholesome, nutritious diet, kriyas, cleansing techniques, and asanas. In asana, very clearly, Patanjali says that to do sthira sukham, maintain effortlessly and enjoy the stretch in the part by doing conscious, wakeful relaxation to the sick part of the body by giving a mild stretch to the sick organ. And these are the three asanas which we use in diabetes. So in this position, while the person is maintaining, what should the mind be doing? It will come to the stretched part of the physical part, and from there, deep conscious relaxation, diffusion, and getting lost in that quiet state. In that point is the healer within. Then we use prana, pranayama, and breathing practices to help them by making our breathing very slow, develop mastery over the excessive speed of prana, balance the prana that reduces the sympathetic tone. So, having said this, for every disease, we have a separate set of physical yoga, breathing yoga, but the common one for all of us is to recognize the stress factor and change our response pattern through karma yoga, bhakti yoga, and jnana yoga. Let me spend the next 20 minutes to briefly give you the research Vyasa. And just now I talked about Pranamaya kosha. I am going to show you some results of how we track the prana, tracking Pranamaya kosha by gas diffusion visualizer is one of the equipment which was developed to record the photonic emissions from our body surface, which depicts the pranic balance in our body. We have what we call as biowell, which is a small equipment which we use to record the pranic emission from the fingertips, and that gives a picture like this. It depicts the aura around the body and the disturbances in that. So I got a few examples here. A healthy aura is looking like this, but in cancer, which was in the lung area, there is a lot of erratic pranic activity going on. Subject has a hole in the heart, a pranic aura is blocked there. So we do record this GDV chakras and demonstrate whether the prana is in balance or not. If it goes out of this green line, that is abnormal. So this is an example of another condition, erratic before doing yoga, after doing yoga. What happened to the energy field? Before cyclic meditation, chakra imbalance, after cyclic meditation, alignment. This is what we mean by bringing balance to the pranic flow in the left and the right nadis through Nadishuddhi Pranayama. It also demonstrates the autonomic imbalance. We also measure the prana activity through what we call as accugraph, which has been developed on the concept of Chinese medicine or prana. And this also gives which are the organs where the energy is high, low, or split. So these are cases where we can demonstrate which are there is no green at all in this disease. Say green areas are very little, showing the prana imbalance and specific organs where it is lacking. Breast cancer patients normally disturbed heavily. We also have Vata, Pitta, Kapha, Ayurveda, Nadi Tarangini, which is also measuring the prana in the imbalance. So we measure the spectrum of the arterial pulse. So if Vata, Pitta, Kapha are in balance, this is how the graph looks like. When there is imbalance, these are diabetes patients. Where we were able to show that their Vata is very much disturbed. And after yoga, we show the changes also. We also have another instrument called random event generator, in which we can measure the consciousness field. So we have 4 gadgets which are being validated to measure the pranic flow or the aura flow of the consciousness field. Now coming back to working at the Manomaya kosha, we do a lot of meditative techniques, dharana, dhyana, and dharana is to fix the mind unwaveringly on a single object. Whereas once we focus the mind through a small movement, say I have a joint pain, you focus the mind by gentle movement in that area, and from there go on into a diffuse slowness. So after we have stretched a point, fixing the mind, we have to relax on that spot itself. So if you are doing Padhastasana, there is a stretch in the back. Bring the mind focused on that area and maintaining the final posture. Relax all other parts of the body and this area which is getting stretched. And from there, let go the activity, diffuse into expansion. Patanjali uses the word prayatna shaitilya nanta samapatti, local slowing down and diffusion into unlimited expanse. I'll give you a small example. We had a participant who had high blood pressure and it was not coming down over 4 or 5 days. We used to admit participants on a Friday and his BP was 170, 100 and reduced to 160 by 100 next to 3 days. But by Wednesday, 4 days were over and suddenly his BP came down to 120 by 80. My therapist came running and said, see, madam, you have taught us if the BP drops suddenly, you have to contact the senior doctor. And I happened to meet this participant, asked him, why do you think your BP has come down so much? Until then he was not disturbed, he was very happy. And we did all the checkup and everything was okay. But what he said is very important for us. He said, madam, today we start the day at 5:30 a.m. with Om meditation. He said, I enjoy that Om meditation. The instructions are very clear. I enjoy that. But this morning something unusual happened. I was enjoying. And when I opened the eyes, everybody in the hall had left the place, including the therapist. I didn't know how much time has passed. And I asked him, maybe he had slept off because early morning, waking up, come to a class where everything is cool and quiet. You may have slept off. In fact, we do have people who snored in our meditation class also. He said, no, ma'am, definitely it was not a sleep. मैं ओम बन गया था was a reverse, he said. What did I had become Om and I had lost myself. And when I came out, I was so happy that my whole system was reverberating with Onkara and whole Prashanti Kutiram, the entire campus. I am drowned in that Om Nada. And whole day when I do my asana, pranayama also, I am drowned in that peaceful experience of Om. This is the point that I want all people to recognize, that if you can touch that Ananda even for a fraction of a second, it is a big healer. So what is the healer within? My own Anandamaya kosha, my own quietude, my own blissful experience. So that happens in sleep, but this is wakeful sleep. So that is the purpose of helping participants to know their self-healing capacity. So we use different types of meditations and devotional practice, emotion culture, moving from violent emotions to soft emotions. Anger, irritability gets shifted to pardon, tension and fear to faith. That I mentioned, to react, not to react, kartum, akartum, anyatha kartum. To react, not to react, or change our response pattern from violent emotions to soft emotion is possible through bhakti practice. We move from our constricted, complaining, fault-finding personality, which is the work of the intellect, to develop tolerance, acceptance, and surrendering attitude in our life. Swami Vivekananda said, when you surrender, you become one with that universal consciousness, which is the definition of yoga.